Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, it's Lindsay Smith-Rogers, producer of Public Health on Call. And today, what happens when a police chief goes to public health school? Don Hedrick is the chief of police of Rapid City, South Dakota, and a doctoral student at the Johns Hopkins Bloomberg School of Public Health. He speaks with Dr. Josh Sharfstein about wholesale changes in policing informed by public health strategies that have made Rapid City safer and more welcoming for all. Let's listen.
Don Hedrick, thank you so much for joining me today in Public Health on Call. Are you out in Rapid City now?
I am, and really appreciate the invite and really appreciate you having me here. I'm honored.
Well, I'd like to start by asking you to introduce yourself a little bit to those who are listening.
So, as mentioned, my name is Don Hedrick. I've been with the Rapid City Police Department. Going on, this will be my 23rd year here. I started out as a line level patrol officer a long time ago and sort of just worked my way through the ranks. I didn't necessarily have intention of becoming the chief of police when I started. Those are just sort of how the chips fell. And I took over in 2020 as the police chief here, which was an incredibly challenging time for many people. We were dealing with COVID. We were dealing with many issues in conjunction with the murder of George Floyd. We were dealing with protests. It was really just a very difficult time to jump into a position. But, I've got really an amazing team around me, and maybe I can bring up some of the ideas and concepts they've helped me with over the last.
That sounds great. But first, I want to ask you about your education, because you are unique as a police chief in that you're working on a doctoral degree, a DRPH degree in public health. How did you get there?
We had done a lot of work with the International Association of Chiefs of Police, and there were several folks from that program that were also working on their degree at Hopkins through the Bloomberg School of Public Health. And I learned about it, and I learned about the concept from them, and I just thought it would be really interesting to hear what else is going on in the country, what else is going on in the world, because a lot of public safety issues overlap with public health issues. And once you see that, it's really hard to unsee it. It's really challenging to look at things from the same point of view once you've started to look at the root causes of some of the issues that we're dealing with in police work. And a lot of times they're overlapping with public health issues.
So when you think about overlapping issues, what comes top of mind?
Well, for many, many years, law enforcement has been tasked with a lot of things, probably outside of their scope. And I think a lot of that comes down to when you pick up the phone and ask for help, there's only a handful of agencies that are out working at 2 a.m. And a lot of times you end up with a police officer. And, for example, the area of mental health. Many of the folks that police officers are out dealing with are struggling with mental health issues. Substance use is another big one where that overlap between law enforcement and public health exists, particularly for us as well, the issues in regarding homelessness and houselessness. Many folks are struggling in our area with these public health issues, and as a result of their needs not being met, they end up on the doorstep of the criminal justice system.
So in a way, getting a public health degree gives you a different kind of toolkit to handle these issues that have been sort of left for the police to engage with.
Yeah, I would say it's really encouraged us here at our department to take a look at what other resources are out there besides us alone. Really trying to find partnerships with social workers, mental health providers, substance use providers, and really trying to partner with them closer so that when we're in the moment of intervention, we have more resources, we have more access to folks that specialize in these type of fields. That way you're not just leaning on the law enforcement and criminal justice system alone. I'm trying to bring those resources out there on the streets with us, and we've had some success with those partnerships.
So tell me about one. Tell me about one of the specific projects you were interested in developing.
Many times here when we receive a call in regards to homelessness of some kind, many times folks aren't even breaking a law. It's just that nobody knows who else to call. And, law enforcement, we only have certain tools at our disposal. And 20 some years ago when I started, I would say the jail was leaned on pretty heavily for social issues, mental health, substance use. And what we
So are you
found,
saying someone might be put in jail essentially just for being homeless?
maybe a low-level crime was found, maybe an open bottle of alcohol or something, but without having access to partnerships and having these relationships in place, jail might have been where they ended up. And what we found, utilizing a system like that was, essentially you're taking up the time of a police officer, booking folks at the jail, the court system, judges, attorneys. And at the end result, you had somebody that was essentially just put right back out on the street. And we never addressed the issues that caused them to be in the spot they were to begin with. We didn't address the mental health issue. We didn't address the substance use issue. We didn't find access for housing, for example, for somebody that just needed to get off the street short term. And it was very costly and ineffective at addressing the issue. It was sort of a revolving door. And, even 20 some years ago, I can remember thinking how inefficient this was.
Yeah.
I think building these partnerships with folks that specialize in these fields has allowed us to take folks that we normally would have 20 some years ago arrested for a low level offense. We overlook the offense and try to get them connected with substance use or mental health, or even some of our homeless outreach folks. And sorry, I have one more thing to add to that, if that's
Sure.
okay. I don't mean to just
please.
ramble on you here, but about 4 years ago, we started a partnership with an outreach organization specializing in trying to connect up with folks that didn't have a home, homeless. And that was a really interesting experiment here in our community because it was something completely new. Essentially, we were partnering with folks that weren't police officers or, EMS type folks. These were folks that had walked that walk and had lived that lifestyle and were in a different place now. But what we found is they had tools that we didn't necessarily have. For example, I can't say, "Hey, I've been homeless. Come with me. I can help you." But we got connected up with folks that had those experiences, and almost immediately it started to have an impact in our community because they started essentially taking calls for service off of our plate. And at that time, we were very short-staffed. So it allowed us to focus on things that, only police could do. And we allowed sort of experts in this field to get out there and build the connection, build the relationship, get them connected with services, and then do the follow-up that's so important. For example, if we were to take somebody to a short-term care facility, that's it. We drop them off and we move on. However, this group, Journey On is their name, the Street Outreach Group, they're taking the steps to do the follow-up and make sure that when folks are ready, they have the tools at their disposal to start moving in a different direction.
Tell me more about the partnership. How did they have resources to do all that work?
Well, it started out very small. It started out as a very small street outreach team. And unfortunately, here in South Dakota, many of our homeless folks, many Native Americans are disproportionately impacted by homelessness here in our community. I think one of the key pieces to success here was many of the outreach workers were Native American. Some of them had struggled with either substance or mental health issues in the past. They were really able to build connections that a person like me would just never be able to do. And that first year, we started out quite strong. However, the second year, they were handling thousands of calls for service. Calls for service were being directed straight to Journey On, and we had some bumps in the road with any sort of new program.
Right.
Anytime you start something that's brand new, that's going to happen.
Where were they funded from to do that work?
They started out, they were a 501c3, a nonprofit, and they had a pilot grant that they had received. And once we started to partner with them, I was able to work with city officials, and the city actually has a big piece of their funding component now because, it started out as sort of taking some of the calls from law enforcement, but now they're doing a lot of work helping out our ambulance services, transports to the hospital that are very low level that don't require an ambulance. A lot of times Journey On is now handling that. So, I mean, we were seeing an incredible efficiency by partnering together with community members that were able to help.
Chief Hedrick, I'm going to ask you this question. Some people might hear this and think, this isn't normal for a police chief to talk like this, right? And maybe that money that the city is giving this other group could have gone to the police department for a bigger police department and, more cars. I see the pictures of the police car over your shoulder here. Is this sort of like a touchy-feely way of doing policing? Have you heard those criticisms? How would you respond?
Yeah, this was a very new concept in our area. I would say I learned about this through my research at Hopkins and the Bloomberg School. I learned a lot about some of the other programs that were happening in Albuquerque and with the Cahoots program in Oregon and the STAR program in Denver. I was able to really leverage my research to what other cities were doing. So it wasn't necessarily new to the country, but very new in Western South Dakota. And yeah, I had people look at me like I had three heads initially. But I think what really helped us what helped us move forward was data. And of course, going to the school, that's a big piece of what we do here. And I was able to show the numbers don't lie. When you are taking vast amounts of calls for service off of the plate of police officers so they could focus on the things that the community wanted us to do, those numbers don't lie. And when you can take an example of an individual that was in a very tough spot in life and help get them elevated to now they have their own home, they have a job, they're, living life in a different way. When you're able to share stories like that, it has an impact, and we use that quite a bit. But once some of the other partnerships in the city, once some of the other city leadership started to see what was happening here, we just signed off on a contract again for 2025 to continue our partnership with Journey On, and that's all ratified by the city, not by me personally.
Right.
So,
but tell me about violent crime in Rapid City. How has that been trending since you started working on this?
Yeah, well, as I had mentioned in 2020, we were witnessing a lot of nationwide trends. There was an uptick in violence nationwide. We saw that here as well, unfortunately. We had a neighborhood that was very disproportionately impacted by homicides in a very small geographical area. Probably a 2 or 3 block radius that we were seeing just this very intense increase in homicides, and many of them had a tie to methamphetamine, unfortunately. And, we had to do something because this was an area where many families were living, many families with young kids, and were dealing with gunshots and violence. And we really approached this from an angle, and I wish I could take full credit for all this. Believe me, I can't. I had a lot of smart people around me helping me out here with this, but we traditionally, what we would do, 20 years ago, we would just saturate the area with police and just really lean heavily on the traditional police work. However, some of these very intelligent folks I'm mentioning sat down with me and wanted to really focus on the trust building component with the folks in the community alongside of the traditional police work. The thought process was, let's get in. Let's build relationships. Let's start neighborhood watches with the good folks living there. Let's try to empower them. Let's build trust so they feel comfortable calling us when something is happening versus waiting for it to escalate. And then we're there picking up the pieces later. I had a couple of our staff pop into my office one day and said, hey, there's this really well-renowned graffiti artist in the community. He's very connected. He's very in touch with the culture of the community in that neighborhood. And we want to hire him. We want to bring him on board. And I was trying to think in that moment, how was I going to explain hiring an artist? But I got to tell you, that was one of the best moves we could have made, because Tyler, the artist, had these connections in place, and he really spent his full days working on figuring out what was important to the folks living in the neighborhood. One thing that they felt very strongly about was an after-school resource that was safe, somewhere where the kids could go and have a little bit of programming where they knew they'd be safe and they knew they had a place to go. So we worked with management in one of the apartment complexes and obtained it's essentially an apartment, but we turned it into this zone for kids to hang out and talk. And Tyler would be there walking them through what was going on in the neighborhood. And it was just a safe place. And I think that sort of radiated out across the neighborhood. And it led to these community meetings and community gatherings and really people taking ownership of their neighborhood and taking ownership of the problem, aside from just police out there doing what we do. They became empowered. And, guys with a view that I don't have was so important. I mean, for example, he came to me and said, hey, the horse is very significant in Lakota culture, the Native American culture here. We want to bring some horse therapy to this neighborhood in the middle of our city. And I was like, all right, let's do it. Let's do it. Let's make it happen. And it was just this incredible healing opportunity. And, since then, we've continued with our traditional police work, of course. We've continued with our trust building. And then we really started to leverage the managers that were not doing their part, the owners of these apartment complexes that were, essentially not creating a safe place for folks to live.
And then that result was some improvements?
Yeah, that three-pronged approach, since then, homicides, I should knock on wood, but things are going very much the right direction. We haven't had even close to the degree of violence that we were seeing there years ago. And it's all because of these partnerships and really working with the community as opposed to just, enforcing the law. I think it goes back to Sir Robert Peel way back in the 1800s. People are the police and vice versa, and the police are the people. And really embracing that sort of an attitude when you're working with a community to try to solve this issue together, because police can't be everywhere at once. We can't do this on our own. We need help. We need these solid relationships. Pretty amazing to see the change that's occurred in that neighborhood. It really is. We've brought it back to being a safe place for families.
It sounds like you're winning people over to this alternative way of policing. I wonder if you're maybe going to convince some more of your colleagues to get public health training?
I absolutely would be an advocate. And there are a couple other law enforcement professionals in the program that I've had chances to connect with and share ideas. I think once somebody looks at violence through a public health lens, you start to see all of the root issues, as opposed to just normal policing where you're just treating the symptoms. You're never really getting to the root cause. Once you see it, you can't unsee it. And it's been really beneficial for our community.
Well, Don Hedrick, it's really great to catch up with you. Thank you so much for joining me on Public Health On.
Awesome. Thanks so much for having me.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Fernandez-Cesiri. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Social media run by Grace Fernandez-Cesiri. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.